If you are taking medicine for diabetes, high blood pressure and high cholesterol, then this 5 minutes video will be sufficient for at least 70% of you to be totally free of medication. Actually, I am talking of new ACP guidelines which was released on 6th March 2018. But I am sure that many of you may not be aware of these guidelines because most of the doctors around, they have decided not to disclose these new guidelines to their patients, because implementing these new guidelines means to tell their patient to either taper down the current medication drastically or to stop the medication altogether, the kind of medication which was recommended to them for last several years. Actually, all the major trials which happened in the last 40 years, including UK PDS trial, VATT trial, Accord trial, Advanced trial, all came to the same conclusion, and that is trying to reduce the blood sugar with medication causes more harm and at least 22% more death. So now the question is how to implement these new guidelines. 3-step protocol you have to follow. Step 1, the elimination round. Stop diabetes medication, hypertension drugs and cholesterol lowering pills for next 3 days. Step 2, diagnostic challenge, the lifeline number 250. After 3 days of eliminating the diabetes medication, check your blood sugar 2 hours after the lunch. And if the number comes less than 250 mg per deciliter, this means your blood sugar is in a safe range. You need not to continue the blood sugar medication. Similarly, you check your blood pressure after 3 days of stopping the blood pressure medication. Systolic plus diastolic combined, if the number comes less than 250, this means adding systolic with diastolic and the number comes less than 250, this means you do not need hypertension medication also and your blood pressure is already in the safe range. Now coming to the cholesterol medication. When we talk of cholesterol, there are several names, LDL, HDL, good cholesterol, bad cholesterol, triglyceride. In an entire lipid profile, only one number is important, that is total cholesterol. After 3 days of stopping the cholesterol medication, you check your total cholesterol. And if the number is less than 250, this means you do not need cholesterol lowering drugs as well. With my experience with more than 20,000 patients, I can tell you almost 70% of you will have your all the numbers less than 250, that means in a safe range. This means 70% of you can be free of drugs just by knowing this much knowledge. Yes, there may be about 28% of you having the number more than a little higher than the safe range, that is little higher than 250, but at less than 300. That is blood cholesterol, blood pressure and blood sugar. And if you are the one who are having your any of the number in between 250 and 300, need not to continue with the medication, rather change your lifestyle, and that comes step 3 of the protocol, and that is diet modification. Eliminate or reduce 2 things from your life. 1, animal food. Stop or reduce animal food. And when I say animal food, I do not only mean meat, chicken or egg. I also mean dairy products. Number 2, reduce or eliminate the packed and refined food like biscuit, bread, etc. If you can do it, then within the next 3 days, within the next 72 hours, your blood sugar, your blood cholesterol and your blood pressure will come in a safe range. Only 2% of you may have your number more than 300, and they are the true patient. And they are the one who may need medication but only temporarily. If you are the one having the parameters more than 300, you may need my help. You can connect with me through the numbers or the email ID given on the screen. Hope to see you someday in person. This is Dr. Biswaroop Chowdhury. All the best. Thank you.